Welcome back, my friends. Is artificial intelligence on a collision course with white-collar, high-paid jobs? Microsoft announces new AI tools to help doctors deliver better care. Microsoft introduced new tools in Microsoft Fabric and Azure AI for healthcare organizations. The new products can combine data from sources such as electronic health records, images, lab systems, medical devices and claims systems so organizations can standardize it and access it in the same place. Microsoft said the new tools can also help eliminate the time-consuming process of searching through these sources one by one, so medical providers can focus on care. By now, I think that we have all heard that artificial intelligence is suddenly all the rage. The rising popularity of the ChatGPT online artificial intelligence system has stunned the technology world. But, can artificial intelligence really replace medical professionals? And how does it affect your life? What does it mean for big tech companies? What does it mean for the economy? And, what does it mean for the future of the United States? But, before we get into all of that, please press the like button and leave us a comment below. We would love to hear from you. Please subscribe and hit the bell icon so that you are notified of upcoming videos when they are released. And, before we continue, a word from the sponsor of this video. Today's sponsor is ProWorldNet.com. ProWorldNet.com is a job website specifically dedicated to licensed professions. Doctors, including any type of specialty. Nurses, and that includes all grades of nurses. Lawyers, regardless of area of legal focus. Teachers and professors, from kindergarten through graduate school. As well as any kind of job that requires a government license or certification. And ProWorldNet.com also includes short-term gig-type jobs as well. So, be sure to check out ProWorldNet.com if you are looking for a job or an employee. Microsoft on Tuesday announced new data and artificial intelligence products that aim to help healthcare organizations easily access and learn from the mountains of information collected by doctors and hospitals. The healthcare and life sciences industry is responsible for generating more than 30% of all data produced globally, according to a recent report from Deloitte. But it can be challenging to leverage all that information since it is stored across a variety of different systems and formats. Around 97% of all the data generated by hospitals remains unused, for instance. To help address this issue, Microsoft said Tuesday at the HLTH conference in Las Vegas, it developed new healthcare-specific tools in Fabric, a data and analytics platform the company announced in May. It can combine data from sources such as electronic health records, images, lab systems, medical devices and claims systems so organizations can standardize it and access it in the same place. Microsoft said the new tools will help eliminate the time-consuming process of searching through these sources one by one. Microsoft has been trialing Fabric for healthcare with select customers including Northwestern Medicine, Arthur Health and Sing Health, and it is available in a preview capacity starting Tuesday. Doug King, the Chief Information Officer at Northwestern Medicine, said Northwestern is still in the process of moving its data into the Fabric system but that the organization is already excited about the potential. He said consolidating disparate data will ultimately help health systems improve care and see more patients. Data is king now within healthcare, and that goes from everything from understanding what's happening in the OR, to how many patients are coming in, how many patients are leaving the house or the hospital, and then how can you get them in faster? He told CNBC in an interview. King said Northwestern is deploying Microsoft's technology thoughtfully, but it could be a game changer if it is done well. He said the organization is thinking about future applications such as managing patient flow and staffing, as well as how to integrate broader population health data, such as where food deserts are located, into care. The current state of technology and Microsoft Fabric and Azure and generative AI, all of that, it's going to change the way we live. And it's going to change the way we take care of patients. And it's probably one of the best shots that we have to solve some of the biggest problems we have within healthcare, he said. Microsoft also introduced new tools for healthcare organizations within its Azure AI services Tuesday. The company will offer a new generative AI chatbot called the Azure AI Health Bot, which can pull information from a health organization's own internal data as well as reputable external sources such as the Food and Drug Administration and the National Institutes of Health. Lenicia Vaz, Principal Product Manager at Microsoft Health and Life Sciences, said the chatbot can be used to help staff within an organization ask questions, such as how to treat a specific disease and what the internal protocols and processes are. Patients can also use the chatbot within their patient portal to ask clarifying questions about their symptoms and medical terms they encounter, she added. What's also really important is that we built in guardrails and safeguards into this process, Vaz told reporters at a press briefing. There's a way to verify this information, Make sure the customer can do an audit of the answers to see that they are credible. Microsoft announced another solution called Text Analytics for Health, which can label and extract important medical information from a variety of unstructured data sources such as clinical documents and notes. Voz said the tool will be released in Spanish, French, Italian, German, Portuguese and Hebrew in addition to English. Finally, Microsoft unveiled 3 new models within Azure AI Health Insights, which offers tools to help doctors, nurses and researchers make more informed decisions. The first model, Patient Timeline, gives clinicians a simple, chronological overview of a patient's medical history by using generative AI to consolidate information from different unstructured data sources. You're able to visually see, immediately, there was a medical encounter here, there was a procedure done here, this is the medication that someone took, and, the clinicians, able to get a really good picture, Voz said. The second model, called Clinical Report Simplification, allows clinicians to use generative AI to simplify reports full of complex medical terminology into language that patients may understand better. And the final model, Radiology Insights, aims to help clinicians and radiologists by identifying errors and inconsistencies that can come up across different reports. The model can also offer follow-up recommendations. Voz said Microsoft's new healthcare tools within Azure AI will help improve patient experiences and allow clinicians to focus on delivering better care. The new solutions are available in a preview capacity starting Tuesday, Microsoft said. The notion of technological advancement upending the job market isn't a new phenomenon. Robots and automation, for example, have become a mainstay of factory floors and assembly lines. And it has had various effects on the workplace, by displacing, changing, enhancing or creating jobs, experts said. Artificial intelligence, a relatively nascent and fast-moving type of technology, will undoubtedly do the same, experts said. However, it's likely such tech will target a different segment of the American workforce than has been the case in the past. AI is distinguished from past technologies that have come over the last 100+ years, said Rakesh Kochar, an expert on employment trends and a senior researcher at Pew Research Center, a nonpartisan think tank. It is reaching up from the factory floors into the office spaces where white-collar, higher-paid workers tend to be. In basic terms, AI is built to mimic a human's cognitive ability, i.e., to think like a human. It lets computers and machines perform tasks by themselves, Kochar said. ChatGPT, an AI chatbot developed by San Francisco-based OpenAI, went viral after debuting to the public in November 2022, fueling a national debate as millions of people use the program to write essays, song lyrics and computer code. Such technology differs from robots, which generally perform physical tasks like lifting or moving objects. In a new Pew study, Kochar found that 19% of U.S. workers are in jobs with high exposure to AI. The study uses the term exposure because it's unclear what AI's impact, whether positive or negative, might be. The high exposure group includes occupations like budget analysts, data entry keyers, tax preparers, technical writers and web developers. They often require more analytical skills and AI may therefore replace or assist their most important job functions, the report said. Workers with the most AI exposure tend to be women, white or Asian, higher earners and have a college degree, the report said. Certainly, there could be some job displacement, said Corey Stahel, an economist at JobSite Indeed. However, AI could also open new occupations we don't even know about yet. Conversely, 23% of American workers have low exposure to AI, according to the Pew report. These workers, like barbers, dishwashers, firefighters, pipelayers, nannies and other childcare workers, tend to do general physical activities that AI, at least, in its current form, can't easily replicate. The remaining share of jobs, 58%, have varying AI exposure. In 2022, workers in the most exposed jobs earned $33 per hour, on average, versus $20 in jobs with the least exposure, according to the Pew study, which leveraged U.S. Department of Labor data from the Occupational Information Network. Fear of technology and its ability to destroy jobs has been around since the Industrial Revolution, said Harry Holzer, a professor at Georgetown University and former chief economist at the Federal Labor Department. To date, these fears have been mostly wrong, but not entirely, Holzer wrote recently. Over time, automation often creates as many jobs as it destroys, added Holzer, the author of the 2022 book titled Shifting Paradigms about the Digital Economy. Technology makes some workers more productive. That reduces costs and prices for goods and services, leading consumers to feel richer and spend more, which fuels new job creation, he said. In advanced economies like the US, New technologies have a negative short-term impact on net jobs, causing total employment to fall by 2 percentage points, according to Jean Kienberg-Hanlon, a World Bank economist. However, the impact swings modestly positive after 4 years, he found. However, some workers lose out, Holzer said. That group largely includes workers who are substituted by technology, those directly replaced by machines and then forced to compete. Digital automation since the 1980s has added to labor market inequality, as many production and clerical workers saw their jobs disappear or their wages decline, Holzer said. Business owners, who generally reap more profit and less need for labor, are often the winners, he said. The new automation of the future, including AI, has the potential to cause much more worker displacement and inequality than older generations of automation, perhaps eliminating jobs for millions of vehicle drivers, retail workers, lawyers, accountants, finance specialists and healthcare workers, among many others, he said. It will also create new challenges and needs like retraining or reskilling. Those may have knock-on effects, like childcare needs for disadvantaged workers, Holzer said. Indeed, data suggests there's been a pretty significant uptick in the number of employers looking for workers with AI-related skills, Stahel said. But, what do you think? Please leave us a comment below and hit the like button. We would love to hear from you. Please subscribe and hit the bell icon so that you are notified of upcoming videos when they are released. Please share this video on social media. Thank you for watching.